Good afternoon, everyone, and welcome to the U.S. Chamber Foundation's Path Forward series. If you're just discovering Path Forward, we're delighted to have you with us. And if you've been joining this series regularly, welcome back. Right now, with vaccines being rolled out across our country, our nation is returning to health. And with summer around the corner, many Americans who've received the vaccine are able to get back to family vacations, backyard barbecues, and many of the things that we had to halt in an effort to slow the spread over the past 14 months. As a nation, we have made great strides, but we must continue our commitment to fully defeating the pandemic here at home. And with the tragic situation unfolding in India and other hotspots around the world, ultimately we know that no nation will fully return to strength until all nations return to health. To help us explore these topics and more, today we're delighted to be joined by CDC Director Dr. Rochelle Walensky. As the nation's health protection agency, the CDC saves lives and protects people from health threats, and it has been the leading agency in our nation's response to COVID-19. We certainly have a lot we want to talk about with Director Walensky, so let's get right to it. Dr. Walensky, welcome, and can you share with us what's the state of the pandemic today in the United States, and what will it look like over the next 6 months?
Good afternoon, and thank you so much for having me. I'm delighted to be here. I'm not yet declaring victory, but I do have cautious optimism. Our progress here in the United States has really been extraordinary. Each week we've had fewer cases, fewer hospitalizations, and fewer deaths, and that has been quite a relief. And our data are showing our vaccinations are working. The number of persons getting vaccinated is growing. We have more than 50% of Americans, or 131 million of American adults, or 131 million who are fully vaccinated, and about 62% who have received at least one dose, which is truly incredible progress. Of course, the goal is to have 160 million adults fully vaccinated and 70% of Americans at least partially vaccinated by July 4th, and I would say, and then more after that. So the recent exciting development as well with the authorization of the Pfizer vaccine for adolescents aged 12 to 15 will also help us. This provides us now a newly eligible population of about 16 million teens and tweens. In the 2 weeks since it's been authorized, we have now vaccinated over 2 million adolescents in this age group. So we're working closely with governors, with local leaders at case transmissions, at vaccination rates, and making data-driven policies to safely get back to our old activities.
Well, thank you for that. And let me follow up and ask you, we hear rumors or concerns about potentially a new surge in the fall. What do you think the likelihood of that is?
So this virus has sent us many a curveball. So I wouldn't want to be too optimistic, but what I would say is if we keep doing what we have been doing, if we have people continuing to roll up their sleeves and get vaccinated, and people who have not yet been vaccinated getting informed about the vaccine and continuing to take the mitigation strategies like masking, I think we have every reason to be cautiously optimistic. Our data are showing that the authorized vaccines are not only working like they did in the clinical trial, but they're working in the real world setting. So we're doing a lot of work in screening, we're doing a lot of work in detection and testing, and we now really have a window of opportunity to have this inflection point with this virus and to increase our vaccination rate. So I really am cautiously optimistic that we can hold steady for the fall.
Well, from your lips to God's ears, as they say. In an earlier episode of Path Forward, Melinda Gates was on, and she said, really, COVID anywhere is COVID everywhere. And so, as you know, one of the things the Chamber and the Chamber Foundation have been working on is thinking about COVID hotspots around the globe. And so as you look with all of your experience and expertise at these hotspots around the world, what does that tell you about how that could impact our recovery?
So first, it's just so hard to watch because we have been there ourselves. For a while, the United States had the largest number of deaths globally, and there was a real sense that we had to put our own oxygen masks on before we had any capacity to be able to help anyone else. But as you have noted, and as Melinda Gates has noted, No one is safe until everyone is safe. And we are increasingly finding this with every infectious disease around the world. So a key pillar of our comprehensive strategy to defeat COVID-19 is to help end this pandemic around the world. And that's why we in the United States are really excited about a three-part strategy to address the global pandemic. We're becoming an arsenal for vaccines by sharing surplus US vaccines and increased vaccine manufacturing here at home and around the world. We're supporting other countries in their response to outbreaks by surging supplies and offering assistance. And we are leading on the international stage by marshaling multilateral efforts with our global partners. And so while case counts are falling here in the United States, global case counts have been as their highest this spring. As I noted, it's just so hard to watch the footage from other countries who I know are experiencing the hurt, the pain, the exhaustion, the sadness that we have experienced here. India, for example, has over 200,000 cases a day, over 4,000 deaths a day. And, you know, our heart is with them. We at CDC are providing technical assistance for them, on the ground assistance, and having a country office there for 20 years. So we have that partnership, which has allowed us to provide that assistance.
Now, turning for a second to some advice for our audience, and particularly the employers in the audience. I think people were quite relieved when you came out with new updated kind of guidance on mask wearing to say that fully vaccinated people did not need to wear their masks inside. But I think employers are still trying to figure out what that means and how can they ask people if they're vaccinated? Is that a privacy violation? How do they find that out? And what is their responsibility to suggesting that their customers and their employees still wear masks? And I'm just curious what you're hearing and kind of what your advice to employers is right now.
So, you know, we released this guidance about 2 weeks ago, and it had become clear at that point and even clearer now as our cases really coming down in this country that everyone is going to start tackling. How is it that we are going to start reversing some of the things that we've been doing over the last 16 months? So the science is now clear. If you're fully vaccinated, you can start doing all the things that you stopped doing because of the pandemic. And that should be for vaccinated people who are not immunosuppressed. And that's why we were able to make this announcement about 2 weeks ago. And so now what we're doing is we're working with governors, local leaders, and really what we're asking them to do is look at their local case transmission rates, their local vaccine rates, to make an informed decision about how to safely get back to the activities across the community. We do know that this virus is an opportunist. So if you have low areas of vaccination in that community, there is a possibility that unvaccinated people, if they don't continue mitigation strategies, could again get infected. And so we do know, though, that the vaccines work, just as they did in the clinical trials. So in the general population, more than 90% effective in real world settings. And so we're really working and trying to help make these decisions locally, looking at vaccine rates, at case rates, and where vaccine rates are low, then having businesses help to boost up vaccination.
So have you been talking to OSHA as it thinks about this emergency temporary standard and what that could mean to employers about mask usage? Are the agencies working together?
Absolutely. So this is an all of government response. We are in close coordination on a weekly and even a daily basis to coordinate across the government, including with OSHA and the Department of Labor. Those partnerships are longstanding, and they have been enhanced even during this period of time.
Well, I'm really glad to see your focus on that, because we do get tons of questions from employers. They're worried about liability. They're worried about kicking customers out, asking employees if they're vaccinated, because it's all the honor system, right? So it's a complicated world, I think, right now, and employers do not want to be the mask police. So I appreciate that you're working with OSHA on it. I think it'll be important for the employer community to get that clear guidance. Thank you for that. So we also asked our audience for some questions for you, and a lot of people responded. This first one is coming to us from Florida.
Hello, I'm Mona DUFFUS, CEO of Dawning Family Services in Tampa, Florida. My question is, are there plans to provide additional clarification around the recent mask guidance to ensure that infection rates do not increase while fully affording fully vaccinated people the ability to relax precautions?
Thank you for the question, Mona. Yes, we are closely monitoring several data points. We're looking at new cases. We're looking at rates, risk of case transmission down to the county level and case burden at the county level. And I look at these data daily, if not twice daily. Again, I'm really cautiously optimistic. Our vaccines are working. We have vaccine coverage in some states. Over 70% have received one dose. So what we really do need to know, we talked a little bit about the honor system, is that people who are not vaccinated remain at risk. And so we really are encouraging people who are not vaccinated to either go get vaccinated or continue to take these precautions until they do so.
We have another audience question from right here in Washington, D.C.
Hi, my name is Polly Hanson, and I'm the Senior Director of Security, Risk, and Emergency Management with the American Public Transportation Association, or APTA, in Washington, D.C. APTA is the oldest and largest advocacy group for transport in North America. Transit workers were defined as essential in the CISA guidance that was published in March of 2020 and prioritized for vaccines in the 1B guidance. We very much appreciated this prioritization as transit workers, especially bus operators, have been on the front lines during the pandemic, transporting other essential workers to their jobs while many of us were working from home. Transit providers understood the need for social distancing and the requirement to wear masks. But now that the country is getting vaccinated and the states are opening up, the requirement to socially distance impacts our ability to provide full service to communities we are trying to encourage to return to using transit. Your guidance suggests that masks are not required for those who are vaccinated, but the federal directive that mandates the wearing of masks in transit hubs and on transit conveyances can and has created confrontational situations for frontline transit employees, especially our bus operators. So my questions are, when will the 6 feet social distancing recommendations for mass transit be amended or terminated? And when will mass transit be added to the list of places where having to wear a mask is not required?
You and everybody in your organization. I can tell you, having worked on the front lines before coming to this position, it was mass transit that got a lot of our healthcare workers to work. So I really had to all the people doing that important work. The requirement for wearing a mask on public transit and the transportation hubs is actually, as you note, a federal order and not just related to our CDC guidance. So, of course, there are many forms of transportation that include a large number of people, vaccinated and unvaccinated, in small places that could increase the risk for unvaccinated individuals if they're not wearing a mask. Public transportation is actually unique in several ways. As you note, and as everybody who's working so hard notes, it's a necessary mode of transportation for people's livelihoods. It is often a small and confined space, and it's often densely populated. So those three factors make public transportation really different from other settings. And given those distinctions, the CDC recommendations at this time are still to require masking on planes, buses, trains, and other forms of public transportation and in transportation hubs, such as airport and stations. We are reviewing our guidance and policies, including this CDC federal mask requirement to determine when and whether other changes need to be made. And I do want to make sure everybody's aware that the social distance is actually not part of the federal mask order. Thank you, Polly.
Thanks so much. So let's shift back to vaccinations for a minute. You had a good stat a minute ago about the percentage of the US population that's actually vaccinated. That's really encouraging. But I think a place a number of us kind of lose the narrative is, what's the percentage that it takes to get to the herd immunity that was so vaunted early on, the kind of goal, the hope that we would get to a point of herd immunity? What do those numbers look like, and do you think we'll get there?
Really great question. Herd immunity is an epidemiologic concept. It's a mathematical concept, actually. And so what I would rather, since we don't know exactly what that value is, what we do know is that the more and more people who get vaccinated, the more likely it is that when a virus hits another person, it will halt its transmission because that person is vaccinated. And so, we're now at about 50%. We'd really like to get up to 70%. We also have some immunity likely from people who have had disease. I do believe that among the reasons that the case rates are coming down now is because we are starting to have more and more people vaccinated. So I think it's a myth to think that we're never going to get the infections down until we reach some mystical level of herd immunity, whatever that number is. And what my job is now is to really encourage people to focus on getting our vaccination numbers as high as they can be. And that is really encouraging people to get vaccinated just one at a time.
So while we're on this topic, we have an audience question from New York.
Hi, my name is Megan Downs, and I'm a registered nurse and clinical quality patient safety manager at WEILL Cornell Medicine in New York City. My question is, as we see mask mandates rapidly and unevenly being repealed across the country, what is the status of an international or national COVID-19 vaccination database to allow validation of vaccination status? Given the unfortunate politicization of mask mandates, surely we can't rely on the honor system alone to keep ourselves and each other safe from COVID-19. Thank you.
Thank you, Megan, and shout out to all of you guys on the healthcare systems in New York for your incredible work. As you know, the honor system is based on honesty, and quite honestly, I think you need to be honest with yourself. Because it is your own individual self that you are putting at risk if you go out without a mask. It is really not the vaccinated people. So the science is clear. Our vaccines are working, and people who are vaccinated are protected. People who are unvaccinated should get vaccinated and then wear a mask until they do so. Right now, we're not planning any vaccine mandates or vaccine verification at the federal level. There will not be federal vaccination database or a federal mandate requiring everyone to obtain a single vaccination credential. So that's where we are at the federal level. We do believe there are reasons for getting vaccinated are clear. It protects you from serious disease or death from COVID-19. It protects your family, friends, and neighbors. And truly, it's our ticket back to normal. So while we're not doing this at the federal level, the private sector may be doing this in some instances. But really what we're doing right now is just to encourage everybody to get vaccinated.
So, as we think about the importance of the vaccines, one of the things that comes up again and again is this vaccine hesitancy, which I think you're doing a great job addressing in your remarks just now. I thought those were important, and we'll spread them far and wide. But as you think about vaccine hesitancy, are there communities that have been particularly hard to reach? And I'm asking, so I'm thinking about how the business community might be able to help.
So this is really important because I think while we can say this kind of person, this kind of sector is going to be hard to reach, I think we really need to understand that this is an individual decision, and everybody has their reasons and concerns for those who might be hesitant, for why they are hesitant, and we really have to meet them where they are and listen. The science is clear. Vaccines have been proven to be safe and effective, and unvaccinated people and vaccinated people can return to many activities. This is based on science. As vaccinations have increased, cases have decreased. We still are seeing data showing rural counties are behind urban counties in vaccination rates, and we're doing a lot of outreach in our rural counties. I was just in rural Georgia late last week and hearing some of the things that they've been doing to try and reach their community. We're making it easy, I think making it convenient, meeting people where they are and listening to their concerns. One of the things that I learned in this rural vaccination site was that they are going to their businesses at change of shift in 4 a.m. and offering vaccines at the change of shift. Oftentimes people who are leaving that shift are going to another place of work. They don't have a lot of time in between shifts to try and get vaccinated. And so really they're going to their place of work. Another recent example is COVID-19 testing and vaccinations were held at Talladega Speedway in collaboration with the Alabama Department of Public Health and Alabama National Guard. So you got your vaccine and you got to take a ride around the track. So, I think what we really need to understand as we're reaching out to these harder to reach communities, the people who might be not the ones who are rushing to roll up their sleeves, is to try and figure out why. Some people may have thought the science was too fast, and we can explain why we were able in this extraordinary circumstance to bring the science without cutting corners to the people so quickly. Some have concerns about the side effects afterwards, and we can present data and talk to people who have been vaccinated and talk about their experiences with side effects. So I really do think everybody has individual reasons. CDC has published strategies to consider for incorporating vaccine hesitancy. We can do confidence consults. We have a lot of resources that are available.
So as we're sticking with vaccines for a minute, I can see pictures of what might be your children or just cute kids you cut out of a magazine. I don't really know which, but I have a child who's 15 who's had her first dose, and we're excited to get her second dose. What do you think the future looks like, or what's the future look like for kids that are younger? Right? What do you think about the 6 through 12 range and when those inoculations might be possible?
So they're doing, right now, they're actively doing dose de-escalation studies. And that's sort of a fancy way of saying, now we have it for 12-year-olds, let's bring it down to 9-year-olds, bring it down to 6-year-olds, 2-year-olds, and even lower. So, we're really hopeful we'll have more data by the fall, if not perhaps by the end of the year. I should say by the end of the year, if not perhaps by the fall, and that we're really working to sort of march our way down and get lower and lower age ranges. But right now, what I would say is, we can vaccinate our teens and tweens, 12 to 18. My 16-year-old was among those vaccinated. You can see him in the back there. He's younger in that photo. And so, I would really encourage, I will say, I don't know how your 15-year-old was, but my kids really wanted to be vaccinated. They really were interested in regaining what they've lost through their teenage years.
100%. And also, just as an editorial comment, I think it's the sign of a really well-balanced working mom when the photo behind you is a little dated. That is what I tell myself every time my daughter complains that the pictures behind me are dated. So, just keep it up, good mom. Speaking of getting children inoculated, we had another question on that topic from an audience member in DC.
Thank you. My name is Mary Farmer. I am from NCRC, National Child Research Center in Washington, D.C. And my question is, as the vaccination trials for COVID-19 continue with children as young as 6 months old, is there the potential that the vaccinations will move to being a mandatory inoculation for the younger U.S. population?
Thank you, Mary. Really important question. At this time, we're not discussing mandating vaccinations at the federal level. That said, I think protecting kids is the most important thing that we can do. There are no authorized vaccines yet for children under the age of 12. And so, first, I would encourage parents and teens to think about getting their teenagers vaccinated, but we need to wait for those kids under 12 and unfortunately continue to ask them to mask and to take other precautions.
Director, you mentioned a few minutes ago some interesting vaccination sites, racetracks and others. And as you probably know, employers are really clamoring for the ability to vaccinate their employees. We have access to them, to your point, at shift changes, other places. A lot of employers already do it for the flu, so there's a little bit of a muscle memory in place and ready to do it. So employers have been asking state and federal government for vaccine distributions to make that happen. Do you imagine a time when the federal government will release vaccines to employers to create worksite vaccinations?
Right. So firstly, providing paid time off, incentives, on-site vaccination are three really important ways that you can take your workforce encourage your workforce to get vaccinated. And the way they were able to do this in the rural clinic the rural sites that I went to was to actually partner with the local public health authorities to be able to bring it to their sites. We will soon be releasing a toolkit to walk employers through a step-by-step guide for ways to get vaccinations on site through our existing channels. And I'm optimistic because our confidence is increasing, and intermittently we're getting these confidence surveys. In January, just 47% of people have either received a vaccine or wanted to get vaccinated as soon as they can. And today that number is 64%. And those are studies according to the Kaiser Family Foundation. So yes, people still have questions about getting vaccinated, and getting vaccinated is a personal decision. We really do encourage people to talk to trusted messengers such as doctors, their families, faith leaders, pharmacists, healthcare providers, and sometimes their coworkers, right? So we really would encourage people to have open dialogue in the workplace to provide informed resources for your workers so that they know they trust you, so that they know that they can get good information from you. So I would say, we are working on a strategy and are hoping to announce more soon about getting vaccines specifically into workplaces.
Well, we'd love to be helpful. So call anytime. Turning to a really serious topic, from what we can tell by the numbers, it looks as if Black people, particularly here in Washington, D.C., are really being disproportionately impacted again. That it looks, I wrote down this number here, they're making up more than 80% of cases reported in D.C. compared with 46% last year. Why are we seeing this increase and this disproportionate impact?
You are raising something that has been part of my everyday career. So public health professionals have long been aware of the disparities in public health in this country. COVID revealed it to the rest of the world. So just to give you some simple statistics, CDC reported the life expectancy loss due to COVID. It was 0.8 years for whites, 1.7 years for Latinos, and 2.9 years for Black Americans. This is among the reasons I took this position at the CDC, is to help make a difference in this area. CDC is taking the lead to address these long-standing inequities with a comprehensive agency-wide approach through a range of key initiatives, including science and research, on-the-ground community-based programs, policy initiatives, workforce development, and pipeline efforts. As I think you probably noted, CDC announced that racism is a serious public health threat and is the root cause of many health disparities in serious public health issue. We need to work on health literacy strategies in order to advance health equity. And so we're working with these communities. I'm really encouraged to see some of the progress that we've made. You note some of the challenges, but really we have been working with our federal retail pharmacy programs, our federally qualified healthcare centers, our FEMA sites, and in all of these, we're really working and have made a huge amount of progress in vaccinating our racial and ethnic minority communities, our rural communities in just in the last several weeks, and really making enormous strides so that we don't see exactly the statistics that you're talking about.
Thank you for that. It's an important topic, and I hope that when we get to the other side of the pandemic, it's something else we can all work on together. Moving back to employers for a minute, another question we get a lot is about COVID-19 testing in the workplace. What is the latest CDC guidance on that?
So if you are vaccinated, then there are testing strategies that depend on the site that have intermittent weekly or several times a week, depending on the site. But we are actually saying that if you're vaccinated, that you no longer need to engage in those testing strategies. So this is really good news because those testing strategies are quite cumbersome. So if you're an employer and you want to invest in making sure everybody in the group was vaccinated versus trying to scale up a testing protocol, I would work towards getting everybody vaccinated because we don't really need a screening testing protocol if you have everybody vaccinated.
Speaking of employers, we have one audience member from Xerox with a question.
Hi, I'm Michelle Kahn. I'm with Xerox Corporation based in Washington, D.C., and I lead the Government Affairs, Sustainability, Citizenship, and Compliance groups. And part of my job is managing Xerox's response to COVID-19. Thank you for taking my question. My question is, will the CDC provide any additional guidance for workplaces that cover protocols for vaccinated and unvaccinated people working together in offices and meeting rooms? And also, what is the CDC doing in its own workplace? That would be informative for us to know as well. Thank you.
Thank you, Michelle. In the situation you're describing, your vaccinated employees would be protected. Your unvaccinated employees would need to take precautions such as masking and distancing until they're vaccinated. We at CDC are following federal guidance with regard to vaccinated and unvaccinated work sites, and so we're working with. We certainly have a seat and are being helpful there, but we're working with our federal guidance with regard to federal employees. So I would say, if you have different sites across the country, you may consider how many people are vaccinated in a given workplace and/or how much community transmission is happening in that place, in that area.
As you may know, Director, small businesses make up a great portion of the U.S. Chamber's membership and a lot of our audiences. And we have a small business audience member from Iowa with the next question.
Thank you for taking my question. I'm Travis Tolliver with the Waverly Chamber of Commerce in Waverly, Iowa. Dr. Walensky, what takeaways from the pandemic do you think would be beneficial for small businesses to focus on so they are better prepared in the future for another economic downturn that is beyond anyone's control?
Oh, thank you, Travis. Small businesses have been essential, and keeping them open in communities is so key to the businesses and the communities. So in order to do this, we need to encourage small business owners to make it easy to get their employees vaccinated. You are often trusted messengers for your community, certainly for your employees, and each of us has a role in being able to get out of this pandemic. So my ask for you is to join our efforts and sharing with your employees why it's important to get vaccinated. We have so many resources for you at the CDC website, toolkits, how you can convey the science, infographics. So, what I would say is small businesses do operate within the communities. It's important for you to know and understand how much disease is in that community. That information is also available on our website. And what I would say is you can go to CDC's COVID data tracker and just find everything down to the county as to how much disease you have, how many people in your community have been vaccinated, and then assist with the on-the-ground work to get people to be interested in being vaccinated.
I think that was an important tool. Can you say that website again?
There's data for at the county level. You can get at COVID data tracker, CDC's COVID data tracker. My Google, I think, goes there on its own. The other thing I would say, if people don't know, is vaccines.gov. If you go to vaccines.gov, you can find vaccination sites near you. If you have a teen or tween who wants to get vaccinated, you can find vaccine. Of course, only the Pfizer vaccine your teen or tween can receive right now, but you can find out which pharmacies have the Pfizer vaccine for you. And then if you text your zip code to GetVax or 438-829, you will get a list of vaccination sites within your zip code. So there are a lot of different ways for people to get information about where and how to get vaccinated, and many of them are even walk-in sites.
That's terrific. Thank you. As you know, part of us getting back to normal is, of course, going back to large spaces with lots of people, whether that's a concert or a theater. And we're all looking forward to that return, I think, to joy. But also for many employers, it's the return of their business. And so we do get a lot of questions about that. And one of them comes to us from Mississippi.
Hi, my name is Francine Reynolds, and I'm the artistic director of a professional regional theater, New Stage Theater, located in Jackson, Mississippi. We are working on our reopening plans. We have a 364-seat house. We can be at full capacity if we want. I just don't know if we should. Should we open to full houses? Thank you.
Thank you, Francine. The music and arts is really something that I have missed among the most in this pandemic. I really do miss exactly the outlets that you provide. I can't tell you for certain where we'll be in the fall. I do remain cautiously optimistic, and I'm hopeful that vaccine coverage will increase and cases will continue to decrease. What I would encourage you to do is to go to that datatracker.com website, the COVID data tracker, and see where you are in Jackson, Mississippi, with regard to vaccination and disease, because what you don't want to do is bring people back and have that be a place where unvaccinated people are not wearing masks if they're at risk of infection.
Another episode of this show, just in case, Director, you haven't tuned into all of them, we had another great episode on the show about Disease X and what we're learning in this pandemic that can help us prepare for the next one. But first, starting with, how prepared do you think we were? How would you grade our level of preparedness?
Here's what I can tell you. I'm an infectious disease doc by training, and before coming to CDC, I was the chief of an infectious disease division. And what I always used to tell my trainees was infectious disease is such an interesting field because we have so many things that are coming down the pipeline, new and novel agents. In the last 10 years, we've had H1N1, we have had Zika, we have had Ebola, and we have now had COVID-19. During that period of time, in the last 10 years, we've lost over 60,000 public health jobs in this country, just in the last decade. So I think we have extraordinary people working in public health, and they've earned their keep this past year, I can tell you that. But what I can also say is our public health infrastructure in this country has been underinvested in. It's been too frail and too thin to tackle what was given to us. When I speak to my public health officers, I hear about test results from COVID-19 that were entered and reported by fax machine, and then data entered by a human being to manually enter the data. That is not a way that we can manage or monitor disease when it is coming to CDC, as it did in January, at 250,000 cases a day. So I think we had extraordinary people working in it, but I think as we prepare for what comes next, we have to think about a really upskilled, trained workforce that is diverse both in discipline as well as background that comes from the communities that they serve. We need to think about our data monetization and making sure that our data systems have interoperability across states, across hospital systems in a HIPAA compliant way. And then we really need to bolster our public health labs.
So I think this next question gets to future preparedness, and you may have answered some of it, but let's see if the way he asks it draws even more insights from you.
Hi. Thank you, Director Walensky. I'm Christian Wickert. I'm based in Washington, D.C., representing EMD Serono, Millipore Sigma, and EMD Electronics. What has the CDC learned with the pandemic, and how will you adjust the pandemic preparedness for eventual future cases that we hope will not happen anytime soon? Thank you.
Great. So thank you, Christian, for that question. In addition to bolstering the public health infrastructure that I just discussed, I think that what we all need to recognize, and what we have recognized, is that public health is not going to be just about public health agencies. This really does have to cross sectors. Public health and healthcare really need to work together. Public health and academia, public health and the private sector, and public health and nonprofits. And I think what we really learned from this pandemic is that we are going to need to work across all disciplines, and that public health alone is not going to be able to own this.
That really serious topic, and one that, again, I hope we'll continue to build our partnership on as we get through this pandemic and work together on public health. So we're turning into a fun weekend, to Memorial Day weekend. This Memorial Day weekend should be more open than last Memorial Day weekend, but we have a broad audience you're talking to here from across the country. What advice do you have for people as they head out of town for the long weekend?
First of all, I'll say I know the airports are really busy. The travel corridors are really, really busy. I was out last weekend with my family, and what you can feel is the palpable happiness, really, of people who are starting to be able to engage with people doing things that they love. And that is so very satisfying to see. And that is okay if you're vaccinated. I worry that people, we have seen more cases after holidays, but we've never done this where 50% of the country's been vaccinated, or 50% of the adults have been vaccinated. So what I would do is say, if you're vaccinated, go enjoy your Memorial Day weekend. Certainly, we've all been longing for some time away, some time to do the things we love with the people we love. If you're not vaccinated, give yourself a gift this holiday weekend and get vaccinated so you can protect yourself, your family, and your entire community.
Well, thank you so much for that public health message. That public service announcement, again, will help get that word out as far and wide as we can. Since we have a few more minutes, I'm going to go to some live audience questions. And the first one is, how long will the various vaccines last before a booster is required?
Yeah, that is a great question. I've answered it several times just in the last day. So let me tell you what we know. The first thing I think is really important for people to understand and to convey is, if you're fully vaccinated now, you are safe now. There has been some confusion where people have thought, well, if I'm going to have to get a booster anyway, I'll just wait for the booster. And that's not the message we're sending. We're sending the message that if you're vaccinated now, you are safe now. And we're looking at boosters to make sure that if that vaccination immunity wanes over time, that we're ready for the booster if we need it. We have seen data that have demonstrated that the vaccines are good out to about 6 months, but we also want to be ready if for some reason we find at 9 months, a year, 18 months, we would need the booster. And so that's the work and the science that we're doing right now. I also think it's important to mention that among the first people we in this country vaccinated were our frailest. They were in our long-term care facilities, our nursing home, our elderly. And they may be the kinds of people that might have a less robust immune response to begin with, which is why we really want to make sure we understand the duration of immunity in those populations.
You know, a question that we get a lot, and I bet you get a lot too, is as you think about mixed populations, so people coming back to work and they may be vaccinated, but they may be working next to somebody who isn't. Their concern is that even though, okay, so try to make this more personal. Let's say I'm vaccinated, but I work all day next to somebody who isn't. Is the threat that I could still carry it home to a young child who can't yet be vaccinated? You know, am I transmitting it? And I think some of the concern in the workforce about mixing with unvaccinated people is they're worried they could carry it home to their young children.
So that is a really important question. And it was something that was not examined in the clinical trials. Could you be, I think what you're asking is, could you be an asymptomatic carrier? which is why at the end of the clinical trials and looking at the data, we were still unsure initially to say it's okay to take off your mask. But over time, and just in the last month, there have been evolving data that have said, if you are vaccinated, even if you were to get a mild infection, you can't bring it home and give it to somebody else. Now, certainly we're still having more evolving data, but really the data have suggested that you're at much less risk of passing it on.
It's a really important message. Thank you so much for taking that question. Here's one that I had not heard, but apparently there is a rumor that vaccines lead to infertility. This audience member is saying, I've heard this from several people and I don't know how to counter it articulately.
Thank you for that question. So that has been among the biggest challenges. That myth has been among the biggest challenges that we are combating as we're talking to people. I am not sure where it came from, but there are no data to suggest that any of our vaccines lead to infertility. And in fact, there is no what I would call biologically plausible mechanism for which that should be the case. Like there's no biology to suggest that that would be the case. However, given that you've heard it, I've heard it, many people have heard it. I've done Instagram lives and they ask me this question. So it is out there, but there is no biology that suggests that that should be the case. And it is not the case. There's no data to suggest that's the case.
Well, that was a pretty firm answer, so I appreciate it very much. And so let me ask you this last question, I think, because it'll let you end, I think, on an important note. And this is, I saw data the other day that suggests 1 in 4 Americans think the pandemic is over. What is your message to those folks?
I think we have to work together as a community to make sure that we're doing the right things for ourselves and our own health and for our community. My job is to look at the data every day. My job is to protect American health. I'm certainly sleeping better than I did back in January, but I'm not thinking we're out of this. What I do know is that there's a lot of disease across the world. That disease across the world leads to potential threats for us here. And that the least amount of virus that is circulating, the safer we will be. And in that way, the more people that are vaccinated, the safer we will be. So when I think about sort of what keeps me up at night with regard to this, what I worry about, I certainly worry about variants that have the potential to evade our vaccines. We don't have any yet, I'm happy to say. I'm worried that not everybody's going to step up to get the vaccine, and I really would like to encourage people to do so, and that's, as I noted, the hard work that we have ahead. I worry about the complacency of people who have not been vaccinated, who've opted to stop the mitigation strategies. So, and I worry that we haven't yet protected all the Americans who need to be protected, and that people who bore the largest brunt of this pandemic in terms of disease severity and deaths are not getting the outreach that they need in terms of vaccinations as well. So that's all the hard work that we have ahead. I'm really glad that America is feeling cautiously optimistic, as am I, but we are not done.
Well, Director Walensky, you have been so clear today. Thank you for your messages. Thank you for your hard work on behalf of the country. You can count on the Chamber and the business community to help you in these efforts and for what lies next and comes next. And so please reach out anytime, and we really appreciate you being with us today.
I'm so delighted to be here. Thank you so much for having me.
Absolutely. And to the audience, thanks so much for being with us. If you have missed any of our past episodes, you can find them at uschamberfoundation.org or on YouTube. We will see you again in June for our next program. And until then, this weekend, if you're not vaxxed, go get vaxxed. And maybe we should all just take the challenge that we'll all find one other person and get them vaxxed. A Memorial Day challenge. Get someone you love vaxxed. Thanks for tuning in and have a safe and happy holiday weekend.